All right, good morning to you. My name is still Dr. Asonye Christian. All right, so this is the second part of the video that I started on CAOSCE. That means the Clinical Assessment Objective Structured Clinical Examination for nursing students. All right, and I told you that this examination is a critical component of nursing and medical council examination of Nigeria qualifying examination. That means you need to do that. You have paper 1, paper 2, and then paper 3 is the CAOSCE and then the Viva. And therefore, success in this assessment requires thorough preparation and a strategy approach. So I started off by giving you some few steps to enhance you to excel in that examination. So we're going to round that up shortly. All right, and remember vividly in last video, the first video I made, I told you that number one step is to understand the CAOSCE format. You have to familiarize yourself with the structure of the CAOSCE, which typically involve multiple consultations where you perform specific clinical tasks within a set time frame. And in nursing, CAOSCE in nursing, you have stations. You have a practice station, you have a question station. And you must attend the practice station and the question station. Now, the strategy there is that whatever you meet at the practice station is similar to what you meet in the question station. Take, for example, if you have practiced or if you are told, the first thing, let me even start from there. The first thing you do when you enter the nursing lab or the exam room for your CAOSCE is to move straight to your station and back your station until you are told to start when they ring the bell. And so when you are told to start, read the instruction. You have station 1, practice station instruction. Read the instruction thoroughly and understand what you are told to do and follow suit. Don't waste time. Read the instruction. If you are told to pass a catheter to a male client so and so, and you report as you are demonstrating the skill, that is what you are supposed to do. Nothing. Don't talk to the supervisor. The only thing you have to do is just greet and then move straight. The supervisor will be watching you and be taking note of what you are doing because there's a checklist with the supervisor. So do what you are told to do. And after you have finished to record timing, you move again. After the mother ring the bell, you move again to station 2, which is similar to what you have demonstrated in station 1, the practice station. So pay attention. If you have done catheterization, male catheterization in that practice station, definitely you are going to see questions on urinary system and then procedures and on catheterization as well. So whatever you do in practice station, every practice station, you have similar thing or similar questions at the question station. That is the secret about. So you need to understand the format. And then the movement is clockwise, not anti-clockwise. It is clockwise. So when you are done with station 1, move to station 2, move to station 3, move to station 4, station 5, and station 6. And then you go out. That is if there is no resting station. Please pay attention. It's very important. Don't delay. So each station assesses different competencies. So they are not the same. Such as patient assessment, clinical procedures, communication skills, and decision making. They are not the same. Do you understand that? So while you are demonstrating those skills, please pay attention to your preambles, your greeting of the patient, and explaining thoroughly what you are asked to do to the patient. Then the demonstration itself. Then after the demonstration, you must also put the patient at rest. Those mannequins, you take them as if they are real patient. You have to make the mannequin or the patient comfortable, and then you go wash your hand and come back, clean your hand very, very well, and then document. It's very, very important. Then second strategy is to review core clinical skills. Ensure proficiency in essential nursing and midwifery skills that you have been taught and you have seen and you have demonstrated or returned demonstration in the lab or while on the ward during your posting, such as For instance, your vital signs measurement, medication administration, aseptic technique, patient education, antenatal postnatal care, and you can name them. So what this will do for you is that regular practice of these skills is crucial, because it's going to increase your competence and confidence during the examination itself. That's what it's going to do for you. Then the third strategy is to engage in simulation practice. There's no shortcut about it. Participate in mock CAOSCE sessions organized by your clinical supervisors or your peers, and that will help you, to stimulate exam condition. The practice will help you to become accustomed to time management or time constraints and performance expectation of each station that is peculiar. And then seek feedback from your instructors or your peers to identify areas that need improvement. That's the essence of engaging in simulation practices. The fourth strategy is to study past questions and scenarios. Your clinical supervisors will help you in this regard. And reviewing past questions and scenarios can provide you insight into commonly tested areas and question format. That's the way it is. That will also help you to enhance your ability to think critically and respond effectively during the examination. That's the way that thing is. There's no shortcut. The fifth strategy or key strategy is to form study groups. You are not an island of knowledge. You need a study group. You need a peer group. So, and in selecting people, don't select people who are otondo like you. If you know you are otondo, don't select otondo, because you have 5-10 otondos. Now 0. So select people who may be above your normal threshold, who are more knowledgeable than you are, and then maybe your peer too, so that iron sharpened iron. Don't select people that are below your own competence, or people within your competence. No. Mix it up. Mix it up. So collaborate with peers to discuss critical clinical scenarios, share resources, and practice skills together. That will enhance your competence as well, because this study group can offer diverse perspective apart from the way you are looking at it, because they have also read wider. So they have diverse perspective, and then mutual support and enriching your preparation process. That is what study group will do for you. And then the sixth key strategy is to manage your time effectively. Develop a study schedule that allows sufficient time for each topic and skill area, because regular focus study sessions are more effective than last minute cramming. Don't cram, please. And competence is not, you can't cram competence and skill. Don't cram. It should be something that wells from within. You understand? So what you don't have, you don't give. Don't cram. Please don't cram for CAOSCE exam. Don't cram. Additionally, during the examination, be mindful of the set time allocated to each session to ensure complete tasks. Please don't leave any tasks uncompleted. So you have to be mindful. That means that you must have been practicing this skill long time ago before examination. Please, this is very important. Then last but not the least, take care of your well-being. Maintain a healthy lifestyle. It's very important by getting adequate rest, eating nutritious meal, and engaging in physical activity. I've seen students who fell ill on the day of examination, and that is why I tell my students 2 weeks to the examination, especially professional examinations or even internal examinations, school internal examinations. Treat yourself. Malaria is endemic here. Treat yourself prophylactically for malaria. And if you have any other condition or pathology, please visit your healthcare provider. Visit your healthcare provider and ensure that you are in right frame of mind for the examination. I've seen students step down because of examination. I've seen students fell ill on the day of examination and couldn't write that exam, that they waited for so long to write. Please, it's very important. So by following these steps, you can enhance your readiness for CAOSCE and increase your chances of success in the Nursing and Midwifery Council of Nigeria examination. So I wish you guys success. See you in the next video.